Like there is a saying that infertility is a big curse on mankind, and especially on all the females, on womanhood, on all the females who want to attain a motherhood. So on the one hand you can say that infertility is a big curse, God has created it, and on the other hand God has also created IVF. God, with the help of science, because God only gave us that boon to have that thing in our mind and scientifically achieve a IVF thing, what is done in the lab, what we call IVF, in vitro fertilization. So now let's talk about IVF, that how much a IVF is successful. It depends that whether you should go for a IVF cycle or not, because these days you hear so much about IVF, that IVF carries a lot of failure rates and it's not successful in all the patients. So the question is that whether we should go for IVF or not, that is a big question that arises in all couples who have got this problem of infertility. So now let's talk about it. First and foremost, what happens in an IVF cycle, who all are involved in it. So the persons who are involved in it, first and foremost, the place where the baby is made, that is the IVF lab. So you should have a good IVF lab, that means a good infrastructure with a good manpower. So the manpower, when we talk about manpower, the manpower involves the clinician, the IVF clinician and your embryologist. The IVF clinician is the person who will make your eggs, who will harvest your eggs, and who will take the husband's sperm and they give it to the embryologist, who mixes it together and who make embryos for you. So embryos, what we call in layman language, you can call that they are the babies who are going to make you happy, who are going to make you parents. So basically we have to have a good lab, and a good lab has to be maintained also properly. It's not that the lab is there and you don't do the maintenance. So a good lab with good maintenance, good clinician, good embryologist. Now we come to the patient. So we need to have a good womb. Good womb means the womb is the place where the baby is going to be like grown further. So obviously you need to have a good womb. So to create a good womb, we first assess the womb and we try to make it good, either by doing a surgery or medically, or by giving you various hormones for its good growth, good blood supply. Secondly, the thing that we have to focus is on the womb, like what is going to be placed in the womb. So the thing that is going to be placed in the womb is your embryo, your baby, that is going to come as a boon to you. And this embryo is going to be made by the oocyte that a female is going to produce with the help of the clinician and the husband's sperm. So now if you have got a good oocyte, or if the clinician has been able to improve the quality of the oocyte, which can be improved only slightly, so we can harvest that good oocyte, or you can go for a third party reproduction, means you can go for a donor oocyte. In some cases, when the husband is not able to produce sperm, so then it is a big tricky question, and then the husband feels very dejected, and then the male part comes into role, and the male ego, as everybody knows, it comes into role. So for all those males who are seeing this video, you should not be like depressed, because many males who are not able to ejaculate, or the sperm is not there in the semen sample, that doesn't mean that you are not carrying sperms inside, or you cannot have your baby of your own. For all these males, we have got different techniques and we are able to make them fathers with their own sperms. So IVF is a big boon for all these couples. So to come back to the same point, we make good embryos with good sperms and good eggs. And we as clinicians, we have to work towards it, toil towards it, so that our patients are able to make good embryos for us. And thirdly, if the patient is not able to do that, and that is a very like a remote possibility, but yes, we do follow practices where we use donor sperms and donor eggs. And we try to make good donor embryos, or from one genetic parent the embryo is there, then it is not a donor embryo, but definitely the one gamete is used from the donor. So to improve the success rate, we do these kind of things, and plus the womb is also prepared and simultaneously it is put there. Now for the females, when the baby is put in the womb, so it is very essential that you give proper nourishment to the baby by eating proper, hygienic, good, nutritious food, like you give when you plant a tree. Obviously you nurture it very nicely in a nursery. So it is the same way you have to nurture your baby which is in the womb, and you have to be very positive. You have to think that this is going to lead into a healthy pregnancy and a healthy delivery. And secondly, you have to have all your stress at bay. That is very important, because the pituitary gland will give you a lot of stress, and don't do that, because that will lead to definitely a failure of an IVF cycle. So like to put things into crux, IVF is a big boon, and all couples who are not able to attain parenthood, they must opt for it once in their lifetime. And the sooner the better, so that we are able to preserve their own gametes and they have their own DNA and genetics in the child. Have a good day.